There are three main reasons why somebody might get a flare-up of their chronic illness symptoms. These can be physical triggers like illnesses, hormonal changes, injuries, overexertion, lack of sleep, lack of nutrients. Can also occur because of emotional reasons such as feeling betrayed or overburdened, or due to high stress and anxiety and trauma reactions. And lastly, environmental triggers are a third category that include things like weather changes, food allergies, temperature changes, noise levels, things like that. And because there are so many reasons for why a flare up might happen, what we tend to do is start writing everything down, analyzing as much as we possibly can, trying to figure out what and why it happened. And there's something to be said about giving some credence to a specific trigger and then eliminating or avoiding that trigger because you can, and it makes your life better to do so. But what happens when you can't figure out what's going wrong? We can get stuck in this trap of spinning our wheels, trying to figure it out over and over and over again. Maybe it was the dairy I ate. Maybe it was the argument I had with my friend or my boss yesterday. Maybe it was because of the vet bill I incurred this month. Maybe it was because of everything. And maybe it was because none of those things at all. And, none of those things could have happened and you still might have had a flare up this month. So while documenting some things can be helpful and trying to gather data and come up with a game plan of things to avoid and things to change and shift, what I have always found to be more helpful in my own life is to focus on response rather than reason. So instead of making a ton of meaning out of why this thing happened, again, trying to analyze it so much, what we really want to do is implement our flare-up protocol, trust that our coping strategies work even when we don't know why, and remember that our response to the situation matters so much more than the reason for the situation. A flare-up protocol should have things like general daily care practices. We should be practicing resting without guilt, eating meals regularly as we possibly can, even when we don't quite feel like eating, using our reliable comfort measures, things that make you feel better, heating pads, baths, setting up your room in a certain way or your home in a certain way, putting the temperature in the house the way that you want it, taking medications that you know to be helpful and your doctor has prescribed for you, and to keep our routines as consistent as possible, at least for a little while, unless that causes you a ton of stress, in which case, let it go. In other words, we practice acceptance. And in that, we move through it a lot faster and with a lot less friction. This doesn't mean you're giving up on trying to figure it out. It's quite the opposite. You're actually giving yourself some time and rest from the overactive trying to figure it out so that you can focus your energy more on getting your brain back to a baseline where you can think a little bit more clearly. And then a lot of times the answers will come to us. So you want to maintain a mindful awareness of the situation without the overanalyzing, without the trying to get an exact answer. But it doesn't mean you just ignore everything. You keep a mental note of what's happening and you learn and practice your coping skills so that you are a little bit more regulated. You are able to think a little bit more clearly, even if the brain fog is real, the symptoms are real, the GI distress is real, the pain is real. It is real. And it already impacts our cognitive abilities. So the mindful awareness and the stress reduction techniques simply help take away some of that cognitive suffering, even when everything else is remaining the same.